So the difference between between this and Parkinson's and MS is this one has a higher mortality. So to date, we still don't know how to cure it. There is no cure. We can treat it. So the patient here, the age of onset is between 40 and 60 years old. There's really no pattern as to who gets it. There was one show on CNN wherein a doctor claimed that he cured this with all natural diet, all natural treatment. But there was skepticism because he had 10 patients that he claimed to have cured, but there was skepticism because no other doctors saw those patients. So there was concern that maybe those patients didn't have ALS in the first place. Hey, that's why his work, wasn't duplicated. I mean, it went nowhere. But anyway, so the first one known one to have it was Lou Gehrig. He was a famous baseball player. He went from weakness to paralysis to a ventilator, and then died from complications of being on a ventilator. So the lifespan is you'll be lucky to get to 5 years after diagnosis. So the treatment basically is supportive treatment just to delay the disease progression, buy the patient time, because 40 to 60, that's not old at all. Okay, so these are young, young men, young women who, have families, so they want to just buy time just to have, much, more days, more, at least a year more with their loved ones. That's all we could do. We don't know what really causes it. So there's no successful treatment. So it's all supportive. So here are the manifestations. As already mentioned, it starts with weakness. So the patient will go from using a cane to now a walker, and then they may try a brace, and then they'll eventually be on a wheelchair, then bedbound, and then once the weakness affects the diaphragm, then they'll be on a vent, and that's it from there. All supportive treatment. So that you give them pain medication because there will be some back spasm complaints. Teach the family how to manage the airway and the ventilator because they stay at home. Some will be institutionalized, but most of these people are family. Have family, so they prefer to stay home. They're given the prognosis as soon as they get the diagnosis, and then that's it. Okay, so there is weakness and then atrophy eventually.
It's not there.
But like I said, there's muscle spasticity, so you can give them muscle relaxants for that, baclofen. So same treatment, similar drugs used in MS and also in Parkinson's. They have bowel and bladder problems, so if needed, they'll be given antispasmodics again, bladder for overactive bladder treatment. So no clear cause. So these are the known risk factors. So some of them have uh, another autoimmune disease, and then they develop this. So we really don't know. I mean, so many people have these, right? But yet they don't have ALS. So we don't know really. That's about it. These tests that we're doing here is simply, again, just like MS and Parkinson's, is simply to rule out other possible causes. Maybe it's a spinal stenosis problem, so they'll check those out. But other than that, no, it's clinically diagnosed, and as already mentioned, no cure. These medications mentioned here does not really, well, it prolongs their life by delaying mechanical intubation. I mean, in mechanical ventilation. Okay, let's just put it that way. So it will just delay them a little bit. Again, maybe buy them up to a year. of time. The problem with these drugs is they are hepatotoxic. So we monitor liver function while on those treatments. And here are the supportive treatments. So muscle relaxants already mentioned. All right. Not much we can do. So, and just similar to any other patient who is bedbound, like dementia patients, so they can't eat anymore, right? So they'll have a trach and then they'll have a feeding tube and they'll develop pneumonia from that. They'll have pressure injuries. Any questions? That's it.